Wanda Hatfield. Rex Jordan. Dick Lay. Curtis Snell.
Here.
Denise Taylor. Here. David Thornton. Victoria Vespas. David Walking Stick. We do have a quorum.
Okay. And the minutes from the February 16th meeting are in your book. We need a motion to approve.
Make a motion to be approved.
Second.
All in favor?
Aye.
Okay, and those are approved. And from Claremore, we have Kathy Smith here to give the report. Hello.
George sent me in his place again today, and I'm real happy about the MRI. It's back up and running, and we're not having any problems, so send us your patients. We're in good shape right now, so I'm proud of that. Still working on the orthopedic request for bid with the area office, but that's getting a little closer. I got some feedback on Friday that hopefully I'll know a little something more definitive this week. So, and that's about all. There's a active announcement out for Chief of Family Medicine. I don't think they had anyone to refer, but we're still trying to recruit, trying to get somebody in there as head of family medicine. So.
Do we have any questions for Kathy?
What was the name of the new lady that's over IHS? If you're Connie, could answer that.
Mary Stillwell.
What is it?
Mary Smith, I'm sorry.
Mary.
Smith.
Okay.
Any other questions? Great, thank you.
Thank you.
And next we have Connie Davis.
Small crowd today, on both sides.
Yeah.
Good afternoon. I just want to highlight a few things from the month of February. Dr. Roger Montgomery and Dr. Sohail Khan were invited guest speakers at a seminar entitled Ethical Research in Oklahoma, the Role of Sovereign Tribal Nation Institutional Review Boards. The event was hosted by OSU Center for Sovereign Nations. There were over 80 guests there in attendance, and after that meeting, there was another meeting with the group to discuss future plans to work together to reduce health disparities and improve quality health for Cherokee. So it's good that that's a topic of agenda in the regions. Some highlights from our ambulatory care clinics. Cooey Scooey had 98 new or reactivated charts. Salina was awarded the 2015 Certified Healthy Business Award, which is a tremendous accomplishment. Redbird Smith, their gym is open to the public Monday through Thursday from 1 to 6:30, so we're glad to see that finally getting operational. And from Friday, 1 to 5:30. They have 99 new members, so I think in my mind that's worth the effort already, so that's good. Let's see. Veneta Health Center added 146 new charts, and Will Rogers Health Center offered blood pressure checks to the City of Delaware, Seniors Delaware Tribe, Senior Advantage Center in Bartlesville, Nowata Senior Center. So that shows the public service that the clinics also provide for our communities, just to highlight a few of those. In Tahlequah, here at Hastings Hospital, Commander Vicki Caldwell, who is a Cherokee citizen, was selected as the Chief Nursing Officer for Hastings Hospital. Valerie Rogers was the Chief Nursing Officer, and she retired back in, I think, the 1st of October or November. So Vicki was a great successor to her, having been at Hastings some years, and a registered nurse for 29. She does hold her master's degree in nursing, and she's doing a fabulous job. Also at Hastings, if you are there very often, Frankie especially, I know you're familiar with the area, but we swapped the medicine and primary care clinic and moved pediatrics over to give them some more exam rooms because they're so busy. And so in that pediatric area, we installed, I lost my place, but some PlayStations for the children to make it more customer friendly. Dr. Stuckey wouldn't leave his office, so he's still there and will be there to infinity, I'm sure. So we agreed to allow him that. as long as he could tolerate the children, or they could tolerate him, I suppose.
That's probably the right.
We performed 321 surgical procedures in the month of January, and due to the efforts by Randy Duncan, our new occupational health nurse, 98% of the staff at Hastings was vaccinated against the flu, which is a very commendable effort by her. In the emergency room, there were 6,664 patients with a left without being seen rate of 4.3%. And I just have to say, the ER, I think I've commented this before, was not electronic before August. They were still on paper. And for them to have a left without being seen rate in the middle of flu season of 4.3%, you know, we were used to seeing 6, 7, 8% at time. I just can't tell you how well they've done with this transition. I really expected to see some trouble there, but they've really adjusted well into a fast-paced environment where, you know, you can't slow down. I'm really so proud of those providers and the rest of the staff. In dental services, we saw 7,082 total visits, and, you know, to highlight a lot of the community efforts that they do that we don't always recognize, that, you know, going out to schools and Head Start programs for fluoride and sealant applications. They went to Tenkiller, Greenwood, Cherokee, Heritage, which is the new school in town, and Grandview, and attended a community meeting in Locust Grove. Our public health nursing provided 518 home visits, and additionally, they transported 413, and sometimes we don't always recognize the effort and service that they provide in transportation as well. Jack Brown here in Tahlequah has 28 patients or clients, 17 males and 11 females, and they're just doing a wonderful job out there. Cherokee Nation EMS served 426 patients and had 633 participants in all their teaching, CPR, advanced cardiac life support, PALS. They do a lot of teaching there. Contract health, in the month of January, we had 8,171 referrals, and of those, 98.23% were approved. Very happy to report those numbers. And in behavioral health, across Cherokee Nation, 1,942 patients were provided behavioral health services. And of course, the highlight for all of us, I mean, it's here in Tahlequah, but for all of us, the joint venture signing with Indian Health Service was on February 24th. We're very happy to get that started. Yes. That's my report. I'd be glad to answer any questions.
Do we have any questions for Connie? Counselor Taylor?
On the contract services, I get quite a few calls about bills that have been approved for payment, but the patient is still getting collection letters and nasty phone calls and that sort of thing. And I'm wondering if, I mean, I understand it takes a while to get all the checks out and everything, but I'm wondering if, once we agree to pay something, can we send a letter to the collection person, whoever is generating the bill, that says, we're going to pay this, it's now our responsibility, do not call this patient. Is there any way that our people can be spared that constant badgering?
It is a frustration, and there's a different story with every call, believe me. And every patient gets a referral. Now, they may not have it in their hand, but the facility gets that. Now, sometimes all the services involved with that hospitalization are not notified of that referral, and that's what generally is the problem, is that everyone involved, like if you need radiology services and there's someone reading those things, then they may not know that Cherokee Nation is the one to call for payment. So we can look at ways, but it'd be next to impossible because contracts within health systems change and doctors change. It is.
So can you tell me about how long it usually is from the time that we say, yes, we're going to pay it, until the end person actually gets their money?
I can't tell you that right now, but I could look to see if we've done a timeline.
Okay.
Shoot, it's Teresa.
I wanted to say, it seemed like you had filled a lot of vacancies over the last,
We've been very busy.
but that's all I have, Frankie.
Okay, Counselor England?
Thank you, Madam Chair. And that's a good question, because we do all get a lot of
I
calls
know.
on that. I mean, daily, we get calls on contract health.
Yes.
My question is, I think they may have fixed part of that prescription phone-in order
Good.
glitch that we was having, but now what they're experiencing is they're putting in their prescriptions and saying it's not in the formula, but they're using, this one lady told me, she said, I'm using the exact numbers that are on my bottle, and it says, you need to come to the pharmacy, this is not in our formula. Is there
So
another glitch now, or?
that's the first I've heard of that one, so if you can just email me that patient, then we can follow up, because everything's a case-by-case issue right now, so
Okay.
I haven't heard that one.
I think it's not adding numbers in there now, they said, so, but now it's just saying it's not available, so.
Today is the first I've heard of that one, so we'll have to check and see.
Okay.
And again, if you have the patient name after this meeting, if you could send me a quick email,
I'll
I'll,
have to get it out of my office.
okay, okay.
Thank you. Thank you.
Counselor Vasquez?
Yes, relating to that same issue, and I stepped away from the table for a moment, so you might have mentioned this, but would it not be possible to give a letter to the client for them to copy and send? Did you already talk about that? Instead of you guys sending a letter to the collection agency, just give the patient one.
We can sometimes do that. We'd have to trust that, I guess, let me put some thought into how that would work,
Okay.
so that it's not a blank check.
So we've got one, I have one, I get calls all the time too, but my most recent one was, it's been a year
It's
since,
too long.
yeah, right.
Yes.
Thank you.
Counselor Snell?
Yes, Connie, pardon me, I'm on the same questions they are about contract health. I've got about 3 or 4 people that's called and said that they turned their bills over to collecting agencies. And I know of 2 of them especially that they had to call contract health to even get them there, you know? And then they come back and turn it down. I don't understand, you know, what. Of course, I know there's a lot of paperwork's got to follow up. What I'm thinking, there ought to be some simpler way to do that than what we're doing.
Well, we'll look at the letter option and see how we can improve that. And again, if patients get bills, because sometimes there's a vendor we don't know about, just get those faxed or scanned to us immediately, and we can get it in to that date of service for payment.
You know, where did Brett go to? I was about to get a hold of him, and there you go. He's gone. Is he out there?
He's-
At your office? new
We're
office?
we're in the annex building on the Hastings campus now.
Well, I know he's
3rd
missing
floor.
me, so I need to get out and visit him.
And I've got him behind 2 locks to protect him. No, you're welcome to come over anytime, but it is convenient
Okay,
for,
Connie. Thank you.
Counselor Warner?
Yes, thank you, Madam Chair. Is there any way that do we have any idea, and this is the pharmacy type question, you know, I know there's people, because I get calls, and one of them last week was similar to Counselor Anglin. They called it in, but it's not the right medicine. You know what I mean? They were supposed to get something else, and they're saying, well, you know, and then the lady was with it enough to see that this is not what her husband would even remotely be taking, you know, that it come up something else. And then she had her daughter, who is a pharmacist, call and put this in, and she actually got something different, you know. And then there was another instance where they've got two months supplies back-to-back days. You know what I mean? Like it came in the mail, and then they got another one. I mean, how much is this costing us to be, you know, because I know there's a lot of that where we had all these glitches to where, you know, what, do we have any idea where we're sending out stuff that they don't need? Is there instances where we're getting a lot of stuff out there that they shouldn't be taking?
that's the first I've heard of a double feel, I guess, if you
Okay,
would.
right.
So again, everything has to be looked at on a case by case, so
Case by-
if we can
okay.
get that information as well. I
Okay,
hadn't heard of
all right,
that.
all right.
Usually it's not enough, they haven't received it in a timely manner, so.
Right,
getting-
well, you know, and I've seen, you know, there's been several, one gentleman, he said he'd got something that was, he hadn't taken in several months, you know, and then the doctor had already taken him off of that. And I know there's been some issues with the doctor, how the system talks to the pharmacist and the pharmacist talks to the doctor, you know, there's been that, if the doctor doesn't put it in right, then it's not gonna be right, you know what I
Right,
mean? And they
right.
don't, and the pharmacists don't even know that they've changed this, you know what I mean? So and then you get into the queue, I mean, I've got a breakdown over the weekend, you know, on how a lot of this stuff and how enormous the issue with the queue and how you guys have got all hands on deck trying to get stuff out of that and some other things. So, I mean, I realize we're working hard. I just start thinking about numbers and money going out and how much it's costing us and, you know, and different things, so.
I appreciate it, and I'm impressed with your fluent reference to the queue and knowing what that is.
Right, well, and I know you guys got a lot more pharmacists at Hastings, you know, and then we've got a big problem at Redbird. I get a lot of calls because, I mean, I'm down in that area, you know, and, well, I don't know, there's so many angles to look at this issue from, you know, that it's scary, you know, and I
It is.
mean, you know, because, I mean, I can remember when Mr. Sanders said, hey, February, well, we're in March. I'm sitting here thinking as a rational, pragmatic individual that I couldn't put a date on this thing. You know what I mean? And when is it, we've gone to a certain, you know, and when we put in the new joint venture clinic, are we gonna use the same thing? Are we gonna do something different?
I would hope that it was improved by far, even within 6 months.
Okay, okay, all right, thank you.
Counselor Taylor?
Okay, I said it was done, but I had another note here on the third-party revenue. It's down significantly, almost across the board, and I'm wondering if that is a result of the accounting change.
It is. There's a lot of things we're learning to do, a lot of reports we're having to build, and which did surprise me. But all in all, it is down significantly.
Because of the accounting change or because of revenues are down?
The revenues are down some, and we're a huge backlog of coding.
Okay.
And so we're in the process of trying to get that caught up. And we're kind of in the dark where that will land us, but we are short on revenue.
All right, thank you.
I have something. Connie, I sent you an email and I've not gotten a response on it about doctors completing disability forms for patients. Do our doctors do that?
There has been a policy since I got here that the docs do not do those. And I may call Dr. Montgomery up here because this is something we've kind of debated and discussed. The majority of time, these documents are forms for an attorney's convenience, as I understand it. Does not require a physician to complete them. And it takes a lot of the provider's time to just do paperwork that the attorney is needing to do their case. And I don't hear you rushing to my rescue.
Well, I
I'll
know,
corroborate what she says, that the determination of disability is made by the Social Security Administration, not by a physician provider. The Social Security Administration makes the determination whether a patient is disabled based on information including the patient record from one of our providers. But again, our doctors don't make the determination.
yeah, I realize we don't make the determination, but a lot of our doctors will not even complete the forms for our patients when they are the only doctors our people see. And if they need that to, be approved for a disability, then our doctors are going to have to step up and do those. I mean, that's the way I feel about it. I don't know about everybody else, but those are the doctors that our people see. So if they have to have a physician's statement, then our physicians are going to have to step up and do those.
Counselor Marcus, the only other comment I'd make is that determining whether a patient is disabled is really now considered a specialty. It's considered a training that's required by a physician to be able to do that. And our providers are not trained to do disability determinations.
Okay, the patient that I was speaking with, all they wanted was a statement of what he was being treated for. And that's all the doctor had to put out. That doctor told him, I don't know. She's been treating this patient 10 years, 10 plus years, and tells him she don't know what she's treating him for.
In that case, I would agree with you that that should be the kind of information our provider should provide or be able to be willing to do. And I would ask you to just give us that specific patient.
Connie's got the email.
Okay.
Yep.
Okay, Counselor Crinton?
Is it the same email that I was sending, same name?
Very similar. No, I think it's a different patient.
Similar.
I think it's a different one.
Okay.
But,
Yeah, Counselor England.
Yeah. I was just gonna, just add that I totally agree with that. If we could come up with a, could we have some kind of example letter, like Counselor,
Taylor.
here, that she, could we have that like next month or something to look at and just possibilities?
Yeah, we'll look at it and see
It's,
what we can do.
Thank you.
I'll just say, I really don't know how that would work, Connie. I mean, to give the patients a letter like that. But, I mean, you can look into it and see.
Well, it'd have to be pretty general. I don't know if how much help it would be. Maybe
Have to
a
specify a
contact
certain
number
procedure and
or a
everything.
data service is the only thing I'm thinking, so.
It's not necessarily that letter, just something.
Yeah.
I mean, it's,
Yeah.
like Mr. England said, it's,
No, let him go.
Okay. Counselor
Even they
England?
won't know, you know,
Did you
if
have
they carried
something
it to an
else?
Yes,
appointment.
Madam
everyone.
Chair, and I believe the letter would get us off the hook anyway, and they'll know we're just not telling them something, so they'll quit calling us. So- And there's the people that elect us to
Yeah,
see
yeah.
us.
I
So we
understand.
want to make them happy.
Yes, we do.
All the time. Connie, I'd asked this a couple months ago or so about, is the Cherokee Nation Blue Cross Blue Shield, are you getting a third-party billing out of them for our clinics and our hospital and stuff?
Yes.
They are paying?
Yes. Our insurance through Cherokee Nation,
Yeah.
we are billing and collecting.
Okay.
Yes. Yes.
Okay, because I'd heard different than that, you know, so just want to make sure.
Yes, sir.
That they're paying their share.
Yes.
Counselor Byrd?
Yeah, Connie, back to Counselor Hargis's comment on the disability. If the physicians are not the ones to do this, and then what's the option for our patients? Where does the form, what's the next step?
In my mind, the social workers or someone of that nature would be the most helpful to patients to complete those kinds of documents.
Okay, has that always been understanding, or is this something that we have to create? You think it'd be a given that social workers would be the ones to take care of these patients?
We'll have to just talk to them and see how they can fit it in, because it's a lot of paperwork in a lot of
Yes.
cases.
Okay. All right. And another, have we filled the Salina clinic yet? Position?
We have made our selection and sent it to Human Resources, and we're not allowed to announce a name until they've done their part.
Good, okay. Jack Brown Center. I know some of those patients that are there, some of them are not Cherokee tribal members. What's the nearest facility that's similar to the Jack Brown Center?
Oh,
Is it Stroud? Because we're always maxed out.
we are always maxed out. Anything
Anyway, you don't
like
have to
ours-
answer that
I really
now.
don't know for sure.
You don't have to answer that now, just thought I'd throw that out there.
Thanks.
Okay.
Yes.
Jared will know that, Mr. Dry, and we can get information.
Okay, all right, appreciate it. All right, thank you, Madam Chair.
Okay, Counselor Warner?
Thank you, Madam Chair. The doctor doing the Hep C study.
Dr. Mira?
Dr. Mira. You know, I've got an update on a lot of that, and I'd like for everybody to realize that how good a thing this is. I know we've had this brought up before, that, you know, the CDC set certain standards on this age group of who you're gonna test, we expanded our standards. We went above and beyond, and if they hadn't have done that, we would miss about 55% of the people that are in this. They're actually going back now, and through this, it's an epidemiological study as well, to where you can pinpoint back, where are we getting the bulk of this, where's this hep C coming from, that's affecting us in this area, and so forth. And not to even mention the amount of money that it costs to get this medicine and stuff like this to help cure it. So I want to applaud that group to end something on a good note, that we even went above and beyond regular governmental standards and set our own. And we got somebody that is that well renowned in that area to come in and help do that. So, thank you.
I appreciate you saying that, Councilman Warner. Do you have the current statistics, Dr. Montgomery, on tested?
Sorry.
But we've cured several hundred cases, and no one has complained that they were randomly tested without
Right.
any, there's a consent form, but, we're looking at people who experience needing transplants, and it's too late, and the expense and burden on our health system, not to mention quality of life for these people. And so I so appreciate that perspective. We're doing something tremendous for our
That
patients.
invokes a cultural change as well.
Yes,
So,
yes. We'll be talking more about that.
And Connie, I just have one last question. We've spoken a couple times on the prevention programs and their transfer to Lisa Harden, her group, Perkins. Has HR gotten that straightened out for you yet?
It's not completed yet. We did visit with them last week and hope to see some movement on it in the next week or so.
Okay, I know that the employees of prevention programs are feeling a little lost and ignored. So if we can rush that along, push it along, we need to get that taken care of.
We will keep pushing.
Thank you. Anybody
We'll
else?
Also be giving, Dr. David Gann from our Public Health Department would like to give a public health presentation or update on our efforts, because that's something that we kind of overlook because we're so reactive to disease, and I think it's really good that you guys hear how we're doing some things, very positive efforts in our public health. So I'm hoping next month he asked to do maybe 3 to 5 minutes, so I
That'd
think
be
you'll
great.
really appreciate hearing that.
Yeah.
I just have a comment. I sat in on his presentation at Intertribal one time, and I agree. It's something that
Good.
instead of being so reactive, we are doing things that are proactive.
Good.
So I agree. That's
Appreciate
good
that.
for the whole group to hear.
Counselor Creighton?
Are we, like the drop-in situation at WIMP, are we still just doing the one on Monday and the one on Friday, or are we taking steps toward?
I believe that's still the staffing model, right, because of the number of providers we have there.
So we're still recruiting,
Well, yes, we are.
and I know Frankie feels the same way. I mean, it's a dead horse, but just like I said last month, the no doctor signs, is not acceptable,
Yeah.
I don't know if someone could come and fill in some days, or,
Dr. Doug Nolan from Hastings actually is doing a clinic day over there.
And,
And we're short 2 providers at Hastings, and so, that speaks to our medical staff. And Dr. Montgomery goes and does clinics
Right.
everywhere on occasion.
I know we're all looking forward to that, but
Yeah,
in a committee meeting that's talking about health, I want to always mention that because it's
it's an
so
issue.
vital.
I agree.
Thank you.
Any other questions? Okay.
Thank you.
Okay, old business, none pending, new business, none pending. The announcements, the next meeting is scheduled for April 11th at 1 PM. Any other announcements?
Good.
Motion to adjourn?
I'll make that motion.
Second.
Second. All in favor?
Aye.
We are adjourned.